I'm getting better at reminding myself. So, hey, how is everybody? And welcome to week 2. Okay, so let's cover a few housekeeping items. First of all, does anybody have any questions? Right off the bat. I'm going to cover a whole bunch. Probably going to spend the first 15 minutes doing some housekeeping things, and then we're going to spend the rest doing lecture content. Okay, so a couple of things. Did everybody get the announcement Saturday morning with the recording, with the week 1 content recording, covering weeks 1, 2, 3, 21, and 10? Did y'all get that?
Yes.
I'm just assuming, I'm hoping that you're going to watch it. I mean, I did it for you guys. So, again, I'll go back to what I said in week 1. You're going to get in out of this class what you put into it. Okay, so that is available for you for all of week 1 content. I am going to start tonight by covering chapter 31 first, only because I ran out of time this afternoon with my first class. And so I told them I would do a recording of chapter 31. Well, that's not really necessary because I'm just going to cover 31 with you guys first, and I'll send it off to them. And I know I need to speed up my presentation. So be going through things a little bit quicker today. So we're going to start with chapter 31 when we get into everything. Let's see. As far as campuses, everybody, let's see, why is everybody needing to come back in? I don't understand.
This meeting is being recorded.
Okay. Lakeisha and Margarita, if you could turn your cameras on, please. And everybody needs to mute. Okay. I'm assuming that everybody in this class, here's your, I still don't have the official roster. I probably will get it till the end of this week. Everybody's either from Orange Park, Cutler Bay, Columbus, Norfolk, and Cincinnati. Do I have anybody from any other campus? Okay. All right. Sounds good. All right. Let me get into my housekeeping things. For those of you, I've been in touch with those of you that missed week 1 lecture to make sure you do the recording. I just encourage you that if you missed any of week 1's lecture last week, to go back and listen to the recording. There was a lot of really important information. I can tell from some of the questions I'm getting this week that, Natasha, that's fine. That's fine. That maybe either you stepped away from the went orientation or whatever. So some pretty basic questions that were covered in the orientation. So, if you think you need to go back and listen to it, great. If you think you caught everything, that's great. Before I start, I want to let you know that I'm almost done grading professional development plans that you guys turned in. And I have to say right off the bat that they are awesome. I mean, beyond awesome. Inspirational. I mean, just go get them. Just unbelievably awesome. Professional development plans are my favorite assignment to grade of the whole term. Right? They're just my favorite. I like to read about you guys, what you're doing now, what your long-term goals are, what you do now, what your skill set is, what you've been doing in the past. So, and especially what you want to do in the future. So I'm always inspired by them. And once again, you guys didn't let me down. So this group is another group of future, just simply awesome nurses. So I want to let you know, as a group, just super job on your professional development plans. Okay, so that's first off. Hey, Christina's coming in. Let's see, I have just a few more people. Hey, Christina. Okay, I sent out a bunch of announcements this week. The point two, everybody got the week 2 announcement, right? Okay, there's a lot of attachments to it. Why is there a lot of attachments to it? Because remember, I told you I'm going to throw everything at you and you can use what you want, right? There's 2 things, though, out of the 4 things, the 4 sets of attachments that I sent you that are kind of non-negotiable. So I sent you 4 things, and this is the way it's going to work every week. I send you an announcement and then all the attachments for whatever chapters we're covering. So the first 2 things that I send you that are non-negotiable that you should be looking at are the PowerPoints and the instructor case studies. Okay, the instructor case study is what I get as far as my instructor lesson plan. Okay, so that's what you get as far as PowerPoints and instructor lesson plans. The reason why I send you PowerPoints is I expect you to review them before class. Okay, the PowerPoints are hey, here's what we're going to be covering this week. Okay, so I don't really pay much attention to the PowerPoints in lecture because I'm assuming that you've already looked at it and you just have an idea of what we're covering, right? Because then I take the outline and we go into the book or the PowerPoint, and then we go into the book and cover the important topics and concepts and information we need to pull out of each chapter. Okay, so PowerPoints are sent early for you to review. Okay, if you want to, and then get going and start getting in the book if you want. But if all you get to is the PowerPoints and the case studies, you shouldn't look at the case studies until after you've reviewed the PowerPoints and the chapter, because the case studies are a summary. There's some kind of a summary or scenario presented for that topic. Okay, but what did I say last week about case studies? Why are case studies so important? I feel. Why do I send you guys case studies? I know you guys are tired, but we gotta grind through this. Case studies are important because of the rationales, right? Remember, the case studies have rationales. What did I say about rationales? Excellent source of learning. Okay. As I said last week, the faculty develops the exams. We don't do the HESI, we do the exams. And so we compile the exam questions from the book, from PowerPoints, from case studies, from, chapter outlines. They come from all different places. And that's why I send you the case studies. The other 2 things that I send you in the same announcement is I send you a copy, and I went through this last week. There's 2 student learning activities in each chapter. One is called a practical application, and the other one is called a case study. And these are, I call them student case studies because they're in your chapter. Okay. At the end of both of these exercises, it says, go to Evolve for the answers. Okay, I don't want you to have to do that. So I provide the answers for you. Okay, so those are those attachments. So I know you got like 18 attachments, and that's fine. But I really want you to hone in the PowerPoints and the case studies, the instructor case studies. The other 2, it's up to you. It's just an additional learning activity in each chapter for you. Okay, and then I do need to send out a week 2 Kahoots, but I think Professor Price has to reset all the week Kahoots. I think you found. Okay, so that's that. I sent you another announcement that had 3 different Kahoots activities in them. Okay, your week 1 Kahoot, and then it had a second Kahoot that was the add-on chapter 10, which was the evidence-based practice, right? And then the third Kahoot is something that you need to watch. Okay, it's an introduction Kahoot to primary, secondary, and tertiary interventions. Has anybody watched that? If anybody, whoever watched it, let me know. Was it helpful?
Yes.
Claudia says yes. Anybody want to second that?
Yes, it was helpful.
Okay, great. So Alicia and Claudia, would you recommend it to your teammates if they take a look at it?
Definitely.
Very much so.
If you don't understand what primary, secondary, and tertiary is, they have some good info on there to explain. And even the evidence-based practice, all of it was good. And I even took notes off of the Kahoot.
Awesome. Awesome. So there you go. There's your testimonials to, especially that as we're starting to get into primary, secondary, and tertiary. I told you there's going to be half a dozen questions on each exam that are directly related to primary, secondary, and tertiary. So we have to have an understanding of that. Okay, so those are all in your announcements. The other thing that I put in your announcements this week is about NCLEX. What did I tell you about NCLEX? How are you to access NCLEX for now?
Through resources.
Yeah. Well, several of you have already done the NCLEX. So how did you access it? There were a few ways. Student resources, right? Can access it through student resources. And what was the second way?
I usually log on to Evolve. Yeah, I was gonna say I log
That's why I
into.
was gonna go to Evolve.
Okay. You can log on from another class. You can log on from your link for Med-Surg or PEDS. Okay. Until we get that link into the community module, it's not there. So those are the ways you log on to it. Okay. Lakeisha, what's up?
Never mind. Found it. I'm sorry.
Oh, no worries. No worries. Okay. So does anybody have any questions about NCLEX? Because you have an NCLEX assignment due this week and your subcategories right in your module. And when you go to NCLEX, you select 50 questions. Okay. And make sure when you submit it, I don't want just the first page. I need all 11 to 15 pages because I need to make sure you went in and picked all the subcategories. All right. So don't send me the first page. Somebody, I don't know if it was this class, just sent me the first page and I sent it back saying I need all 15. Okay. NCLEX, we talked, I'm just going through. Oh, for those of you that did review the week 1 content lecture that I sent on Saturday, does anybody have any questions about that? Anybody need clarification on that? My hope is that you go through, when you listen to that, you go through and you compare your notes to this and highlight them on the study guide. Okay.
I've been like writing down like what you've highlighted that's not on the slideshows and like highlighting it too. Just so like I'm like, okay, this is something else I need to focus on as well, but I'm also highlighting the stuff that corresponds with the slideshow as well.
Exactly. So everything, Martha, everything's connected. Okay. The PowerPoint is connected to the chapter. The chapters are connected to the study guide. Everything's connected. Okay, these aren't 3 separate documents. You know, the PowerPoint isn't separate from the chapter, and the chapters aren't separate from the study guide. Everything's connected. So what I said last week is I suggest you go into the, you know, after each week, go into the study guide and highlight off everything we covered. Right. So if you've reviewed the lecture from the weekend, you should have been able to go into the study guide and knock off all the information from chapters 1, 2, 3, 21, and 10. Okay, so what do we have left? We have left today, 18, 19, 20, and 31. So after tonight, if you go back to your study guide, everything should be covered. Right? There's a method to my madness. Okay? So if there are things, and then I ask you, if there are things that are on your study guide that you said, yeah, she went through that tonight, but I was exhausted. She went through it so quickly. Write down what the topic is, you know, highlight that part of your study guide and say, I need to go back and read in more detail that part of the chapter. I would highly suggest you do that before the reviews this upcoming weekend, because you don't want to use the reviews to teach you. We should have done that in the last 2 weeks. Reviews are reviews. You should be coming to reviews with questions, things you need more information on, topics you need more clarification on. Okay, don't use the review sessions coming up thinking, okay, I haven't really listened to the week 1 lecture. I'm sure they're going to cover it in the reviews. No, we're not. We're going to cover what's on the study guide. Okay, makes sense? Okay, what else? So, like I said, my expectation is that you review the PowerPoints and the case studies. That will give you a heads up as to what we're covering. And then I spend most of my time in the book just pulling out, I call them essential knowledge, essential topics, concepts that we have to know. Okay. if you are a repeat student and we haven't been in contact yet, please reach out to me after class. Okay. If you are a repeat student, I've already been in contact with you. Thank you very much. We're on the same page. For students that missed class last week, I am just encouraging you to watch that orientation video. I think that's it. Questions? What questions do you have? Nothing? I know you guys are exhausted. I keep saying that, but we got to go run through this. So who we missing? We're missing Allison. Anybody know about Allison? Allison Graham.
She said that she came to our class last week, but then she thought she was in Lourdes or somebody else's
Lundy?
Oh, I think
class.
she's in Lundy's class.
Lundy's class. So
You said
now she's
Allison Graham.
Yeah,
That's the wrong Allison.
Oh, different Allison. Okay, cool.
Yeah, we're thinking about Allison Patrick.
I need Allison Graham. Anybody know where Allison Graham is? Anybody friendly with her that can shoot her a text and see if she's coming to class? Anybody? Okay. I'll reach out to her. Okay. All right.
For
Go.
the case study of like the healthy people, that's a group assignment.
Oh, yeah.
Whatever
Oh,
we're assigned to, we just split the work and then it's like a Word document. Is that how we're doing it?
who wants to help Cammie out and tell her what the assignment is?
I mean, I see the assignment and I see like what group I'm in. And I know the question that we need to do. I'm just.
You have to
asking
get-
what positive.
You have to get with the group and then y'all pick out what questions each person wants to do. Then you can designate someone to type it up in Word, and then you all have to submit it in the discussion post as an assignment. So
As an attachment.
Yeah.
So it's just like you just submitted your professional development plan. You can submit attachments into the discussion board post. Okay, so thank you, Claudia. So everybody has to submit. So I realize that if Juliet, Alicia, Bethany are in the same group, they're all going to submit the final product. Same thing. I realize they're going to be reading it 3 times. That's okay. Everybody has to submit. Okay, so you're submitting the same thing. What I don't want, what happened last term was confusing, is groups were typing their, Juliet typed her section of her, let's say Juliet, Alicia, and Bethany had case study 1. Juliet was putting in the discussion question her part. And then Alicia down below is putting in her part. And then Bethany somewhere else is putting her part. I couldn't connect everything. You have to do one document with all your pieces. It's a group project. Put a cover sheet on it like you just did, group case study, healthy people 2030. Okay, participants, Juliet, Alicia, Bethany. You guys are up top of my line of pictures. That's why I keep calling on you. Right? And everybody submits it as an attachment. Okay, that is due, like a discussion question, a week from Wednesday. It's week 3. So you have to submit the initial case study, your final product by Wednesday, right? And then what do you have to do by Sunday?
respond
To 2 classmates, each of
Yeah,
us.
2 groups. Yeah, look at 2 groups. Look at 2 other groups that did different case studies from you and comment on them. And then you will be in the same group as with your next assignment, which is infectious disease research project. You'll do that together in like week 7 or something. We don't have to worry about that now. Okay, thank you, Cammie, for bringing up group. Does that help? Does that answer your questions?
Got it. Thank you.
Okay, so please don't anybody send me an email that says, do we all have to submit it? Okay. I can tell when I get really basic questions that, people just kind of check out or don't really listen to the whole thing, but I don't mind answering them. In fact, somebody sent me a really simple question and I said, go ask one of your teammates. It was so simple. Go ask one of your teammates what they heard in class. All right, let's share my screen. We are going to start with chapter 31, and I have to write the time down. It is 6. So let's see. How long have I been recording? Shoot. I told my group I would. So 6. Yeah. How can you tell in your recording where you are? Anybody know? That's okay. I'll figure it out. I'll figure it out. Okay, so we're going to jump ahead to school nurse. Why is a school nurse a community nurse? Why is she considered a community nurse? What do you know about school nursing? Other than me, do you know any other school nurses?
School
Go ahead.
nurses serve like a population in the public. They're serving a variety of students that come into the nursing office at schools.
Yeah. What do you think school nurses do? But we're going to find out. They can do direct patient care, direct client kids care. They can be counselors. They can be social workers. They can be immunization nurses. They can be medication nurses. They can be all different things. We'll find that out. Okay. So just to reiterate, your chapter outline, this whole top, every chapter, this chapter outline right here at the beginning in blue. Okay. Where have you seen that before? What is that? That is your PowerPoint. Your chapter outline is your PowerPoint. Okay, so you're going to get your chapter 31, your first page is going to be objectives, and then the second page starts to go into each of these topics. So your PowerPoint is this outline with information added in there. Basic information, a quick synopsis. And then you take your PowerPoint and the additional information they provided, and then we go to the book and get the more detailed information. Does that make sense? So your chapter outline is your PowerPoint. Your PowerPoint is your chapter outline with some information. Okay. What do we say about objectives? It says it right here, every chapter. After reading this chapter, students should be able to. Here's your objectives for chapter 31. Discuss professional standards expected of school nurses. You can read through them, but this is the goal after every chapter. Maybe you can ascertain all the information to your objectives but in the PowerPoint. If you can't, where do you go? Where do you go get the information if it's not all in your PowerPoint? Some of it might be
In your book.
in your book.
Book.
In your book. And then you get to your key terms. So let's say one of your, let's find a word in the objectives. Let's see. Primary prevention, it's in your objectives, right? It's objective number 5. Assess the nurse care given in schools in terms of primary, secondary, tertiary. So if you think, wow, okay, I didn't want to look up primary. Go to primary right here. Takes you right to the section of the book where they're talking about primary prevention. Well, kind of, they should be, hang on. So those terms, you should be able to go right to, okay. Let's see, hang on. Let's do a health educator, see where they come up. Yeah, okay. So health educator, I clicked on it, takes you right to the section of the chapter where they're talking about health educator. Okay. So that's the basics. Okay. So you have your PowerPoint, your outline is your PowerPoint. You have your objectives, which you should be able to articulate after each chapter. And here's your keywords, be able to discuss, differentiate, describe, assess, identify. And remember, this is your AdPi. Take off your clinical hospital hat right now. Wherever you're doing your med surge clinicals, wherever you're doing your peds clinicals, take off that hat. We're out in the community now. We're working with populations now. Okay. Do your best to do that. Okay, so where can I put you guys where you won't be in the way? Okay, let's see. Okay, I've already gone through these chapters. I've highlighted. I like to highlight things. When I highlight things, it means this is part of our essential knowledge that we need to pull out of this chapter. Okay, not saying everything that's not highlighted is not important. All I'm saying is we can't focus on everything in every chapter. Okay, so I pull out the important parts that want to address school nursing concepts, topics. Okay. Okay, so, and a lot of students follow along with me in the book with their highlighter and highlight what I highlight. So you can do that too. Whatever you want to do, whatever helps you. Okay, so what do we know about school nursing? We know that in the past, historically, school nurses do nothing but put Band-Aids on cuts and give hugs, right? I can assure you that school nurses do more than that. I can assure you. Okay, because I just finished 20 years of school nursing. Okay, and let's see, in the last couple of years, I've done trachs, I've done suctioning, I've done catheterizations, both kids, male, female kids. I've done G-tube feedings. I've done medication administration. I've done, what else have I done? What's my point?
I know some schools are like special needs schools too, like they have
Yeah.
special needs kids that
Yeah.
need like different things and stuff done. Cause I know a long time ago, they had kids that needed catheter, at different times. So they do just do more than just
Yeah.
giving out
We
a
do
little
more.
bit.
I mean, we
So there is
pretty
definitely-
much, yeah, we do everything. There are some things that in Colorado, the state won't let us do, like IV antibiotics through a PICC line or something like that. But we'll bring in LPNs or RNs, or the family will, and they'll do those kinds of procedures. We do contract with procedures that are not part of our scope of practice, but we do more now than give hugs and put Band-Aids on. I can guarantee you. All right. That's what I remember about, fake it till you make it to go home. Right. We all showed up in clinics to cry and go home. Nope, that's not about the case anymore. So let's see. Yes, we'll need to review table 31.1. Okay, so there's some federal legislation that affects school nursing, and this is on your study guide as well. Okay, we just need to know what each of these are. Okay, I'm going to highlight the ones I'd like for you to know. ADA, Americans with Disabilities Act. Okay, No Child Left Behind. Let's know that one. Okay, I just need you to know the definition of these. I don't need you to know when it happened, who's affected. I just need you to know what was the effect on the school. What's the WIC? Remember the WIC pro, we've all heard of WIC, right? Okay, every student succeeds. Okay, so have a look at this and see what federal legislation is impacting. And actually, you should know all of these. You should put this on a card, put this on a little index card. What is the most important federal legislation that has affected schools? Okay. So table 31.1. All right. You may get asked a question that says, here's your scenario. Which federal legislation would be appropriate? Okay. Then it goes through the history of all the legislations. For school nurses, we follow, just like hospice has an organization, home health has an organization, occupational health, school nurses have an organization that we follow, and that is the National Association of School Nurses. Okay. So that's where we get our guidelines. Okay. We also are in school nursing, we follow the American Academy of Pediatrics. Get lots of our guidelines from them as well with regards to kids' needs. Okay. What's the role and the function? What are the roles and functions of school nurses? All right. And we've already talked about that. We potentially are direct caregivers. There are certain things I can delegate to health aides in the schools, but there are certain things I can't. Okay. So nurses may be direct caregivers, educators, counselors, consultants, case managers. We are the coordination. We are the coordinator of the care. All right. So if we have a very impacted student, we participate in their educational process and maybe communicating with the OT, the PT, the speech, right? The specials teachers. How are they going to function in gym? How are they going to function in art, music? Okay, so school nurses play a really important role in the schools. You can read through these. I just need you to know what potential roles you might play. And then it gives a summary of each one.
So
Okay.
I think that nurses in a school are very important because especially in those cases that the child is sick or something, but it's a translation or a psychological problem or problems in the family. So in that point, nurses are very, very crucial, important,
Absolutely.
because they can discover something that is, behind the iceberg or behind the point of the iceberg, because many
Absolutely.
kids traumatize psychological problems.
I can tell you that school nurses are the go-to people in the building, right? In our district, we were consultants, so we all covered multiple buildings, but we were the go-to people, especially with COVID. Okay, when a teacher has a concern about a student, whether it's physical, psychological, behavioral, I can tell you they start with the nurse. Okay, school nurses are the go-to people. They're supposed to know everything about everything. So yeah, you're right. So again, you can read about the different roles. Okay, what are school health services, right? They vary. The CDC, the CDC has developed what they call coordinated school health programs. Okay, some schools have them, some schools don't, but there's lots of different federal school health programs. Okay, so there's one. Okay, what are school health policies and practice studies? Okay, so these are surveys that go out and they look at school policies, practices in each state, in each district, all the way down to the classroom level, to see what are these going to need to succeed, right? And then we have school-based health programs, health centers, and I know we have 4 of them. We have a huge district, but we have 4 school-based health centers, and they're based in 4 of our high schools, and the very high priority need communities. Okay, it's like going to a doctor's office, but they're right in the high school, and it's for the whole community around the high school. So families can use that for their school-based health center, right? So you're dropping off the big kid at school and you got little kids to go in and be seen. Okay, so there's lots of different ways it can look. All right, Healthy People 2020. So let me review a couple of things. Okay, there's 3 things we need to review in every single chapter. Whether I get to it or not, you are still responsible for reviewing it. One is your Healthy People 2020 box. It's always going to be highlighted. Okay, these are goals and objectives related to the topic we're covering, and this topic is school nursing. So what are the Healthy People objectives related to school nursing, school health, and school nursing? Okay, so there are 1, 2, 3, 4, 5. There's 6 of them. I would suggest to put these on a card. If you get a Healthy People 2020 question on your exam with regards to school nursing, and you're asked which is the Healthy People goal and objective, either select all, apply, or pick the one that is. There's 6 listed here. We could probably think of 60 more, but they're not Healthy People 2020 goals. They want to know specifically what Healthy People 2020 goals. So if you're asked, pick all that apply that are school nursing objectives related to Healthy People 2020. Only these 6 can be your answers. You can think of other things that might make sense, but that's not Healthy People 2020.
I got a question.
Yep.
The codes on the side, are those like the ICD-10 codes for the?
Yeah. If you go onto their website, these are I forget what they mean, but if you're going on to the big Healthy People 2020 website, it's all split up in different topics in different areas. Okay, so let's see, reduce the number of school days or work missed days with kids with asthma. RD, I don't know what RD stands for. IVP, increased. So those are the sections that they are in. So you don't need to worry about those. You just need to know what the goals are. Okay, the next section on page 546, you're going to have a look at. This is the levels of prevention in schools. Okay, remember, this is the second section we need to know: primary, secondary, and tertiary for every chapter, because the primary, secondary, and tertiary definition is not going to change, right? We have primary is prevention, secondary is screening, and tertiary, I came up with a T. Tertiary is treatment. So you remember them. And then remember, education can be incorporated into all three levels. Education at primary is we're teaching how to prevent. Education at secondary, we're teaching how to kind of stop the process. We've identified that you're maybe at risk. So now we want to try and arrest that process. All right. So if you're at risk for high blood pressure, what can we teach you and help you so that you understand that we can still reverse this? And then teaching at the tertiary is that illness is already present. So now let's say it's an obese student. What can we do? The student's already obese. What can we teach them to take care of whatever condition they have or improve it? Make sense? This is an excellent figure 31.2. It gives you some samples of what is under primary, secondary, and tertiary. Okay, you with me? And then go through the next part of the chapter. It extensively talks about primary. Here's how to teach your children in school, how to teach young children in school. We're still under primary. Okay. And even under primary, it gives you your case study. There's your case study that's your student case study that I provided you the answers to. Okay. So again, we're still in our primary. Part of primary is prevention. So that's why this is in this section, prevention of childhood injuries. You need to have an understanding, and we'll get to this in the next chapter, is how do we prevent childhood injuries? I don't know what's a primary injury for a younger kid. Maybe bike safety, bikes, safety, helmets. Maybe for kids that are driving, seatbelt safety. You're going to learn all this as you read through this. So we need to understand what's the best way to prevent childhood injuries. Here's some more prevention things that we need to think about. Remember, we're in primary and we're in school nursing. Substance abuse prevention, disease prevention, vaccinations, still preventions, right? Vaccinations are primary prevention, right? What do you do when families don't want to get their kids vaccinated? For religious reasons, for personal reasons, they can't get to the doctor. They don't have a doctor. They live in an area that doesn't have free clinics, or they have free clinics, but they can't get to them. What do you do for that? I mean, there's close to 10% of kids in every school that are not immunized. How do you help educate them? You know, if it's a religious exemption or a medical exemption, what do? You educate them on the risks, that if your child were to get this, here's your risks. So for us in our schools, we had a list, a go list, that if we had a pertussis outbreak, we had a list of parents that we would call that were either not immunized, they were immunocompromised, or the parents requested. If I have do you have a case of pertussis in the school? I want to be notified. Sure. You know, we would call them and say, keep your kids out until this is over. All right. So here you go. Many problems with children not being immunized or having incomplete vaccinations may occur. Right. We get a lot of kids that are coming from other countries with no immunization records. It's really challenging. I mean, it's a federal law. The kids have to be immunized before they come to school, or they have to do an exemption. In Colorado, we just, the Colorado, I think it's CDPHE, the Public Health Department. If a parent was going to do an exemption at the beginning of this 22 school year or 21, they had to watch a video of what the risks are. And the parents had to sign off on that and print a certificate, provide to the school. Otherwise, the kids are excluded from school. There's no messing around. You know, a pertussis outbreak or an outbreak from one of those vaccines it's very serious stuff. Okay, so have a read of that right here. Highlight what I highlighted, page 548. And then we get into secondary. Okay, why do children seek out the school nurse for a variety of different needs? Right, stomach, headache, stomach aches, right? We have all that, but we also have this. In addition, children may seek reassurance from the school or even appear to hide in the nurse's office. Maybe they're being harassed, bullied. You got to be mindful of that. If the kids come in at the same time every single day, and it's between fourth and fifth period, and they can't have a stomach ache for 2 weeks, you got to find out what's really going on. And then under secondary is emergencies. How do we do emergencies? How do we care for emergencies in schools? Again, focus on what I've highlighted. Okay. Emergency equipment in the school nurse office. What do we need to have? We don't have splints anymore. We don't keep splints. That could cause more harm. Okay. But we can do oxygen tanks, dressings. Okay. What about giving medication at school? I can delegate that. I delegate that. Right. But, a lot of states don't. Well, a lot of states actually have a nurse in every school. So we don't have that here in the district I worked in. So I had to delegate giving medication. Right. And here's your third thing. Here's your third thing that you have to highlight in every chapter is your QSIN. Remember that from chapter 1. If you have to go back and review that, go back to chapter 1. Chapter 1, quality and safety education for nurses. The actual competencies, the 6 of them are listed in chapter 1 in their QSIN box. So if you have to go back and review that, do that, because each chapter focuses on a different competency. So this competency is safety. Okay, so read about these, read this box in every chapter. So in this chapter, we're talking about safety, minimize the risk or harm to patients and provide both system effectiveness and individual performance, right? Important aspects of safety. And they always go through knowledge, skills, attitudes, and they do a safety question. So this is an excellent, another tool. There's lots of great tools. So the 3 things you have to look at in every chapter are Healthy People 2020, this QSIN box, because it goes through a different competency. There's 6 of them that are identified in chapter 1, and then your primary, secondary, and tertiary. And then the other optional extras are your practice application, your case studies. Right? In this QSIN box, it gives you a question, depending on what the competency is, and it gives you the answer right there. Okay. We're still in secondary, assessing and screening kids at school. Well, we might screen for vision, hearing, height, weight, TB, scoliosis. That's another part of the school nurse's role. We might be screening for lice. Yuck. We are all mandatory reporters. Everybody know what I mean by that? Everybody should definitely know what I mean by that. We are mandated reporters for anything suspected child abuse or neglect. Is that just in the school setting or is that in the grocery store? At least everywhere.
All around.
All around. All right. School nurses, we communicate all the time with healthcare providers. We may need clarification on medications. There may be new problems popping up. The parents may have given us information that's concerning that we want to talk to the doctors about. Right. And then again, we're still in secondary, efforts to prevent suicide and other mental health problems. What's happened over the last 2 years with COVID, with kids?
Depression.
isolation, depression, suicide, drugs, alcohol, acting out, right? That's part of your job as a school nurse. You do in-services, you work with the staff. You know, if you have any concerns, let me know. I'll come in and do observations. I'll talk to the kid. Okay. And then violence at school. Another thing we have to assess for. This is, again, you're screening. We're screening for violence. We're screening for, kids that might be at risk for suicide. Okay, so there's several things we could screen for in schools. Then we get into tertiary, right? Again, really important here. We're using the nursing process. Okay, assessment in the school is going to look a whole lot different than assessment in the hospital. Implementation in the hospital is going to look a whole lot different than implementation in the schools. All right, but we are using basic nursing process. All right, so first one, if a kid's on medication, tertiary is we have to act that out. The kid's on medication, we have to figure out a way to make that happen. Right, we need to know what the medication is, what time it's supposed to be given, right? They already have something that requires a medication. Right? We need to know if the kid has a child has a hearing or vision problem. That's why we do the screenings. If they have a hearing and vision problem, then that's been identified. Now we have to work with the appropriate staff to accommodate that student. Okay. Same with kids with allergies. Need to be aware of who has allergies. What are they allergic to? Do they need an EpiPen? How do we communicate that with staff members? They already have an existing issue. It's our job to make sure if they need medication, it's in the building, has the right paperwork. The teachers are trained on how to give an EpiPen if they need to. Okay. And then same with kids with asthma. Teachers need to know which kids have asthma. And not only which kids have asthma, which kids have inhalers in the building. You may have 30 kids with asthma and have 4 inhalers. Okay, but if they have an inhaler, they may need it during the day. So again, they already have asthma. It's up to us as a school nurse to communicate that. Children with diabetes, children who are autistic, ADHD, special needs, right? They already have these issues. We want to make sure they are inclusive in school. How can we get them how do we make sure that they can attend school? What support do they need? Okay. Kids with DNRs. There's kids in school with DNRs. There's kids in the school system that are homebound. I'm still responsible for knowing which kids are homebound and what their medical issues are. And then what do you do with pregnant teenagers at school? How do you work with them? Okay, so the last group is all kids that have issues or medical diagnoses. It's tertiary, right? We're working with them to minimize, manage their conditions. Okay. And then what are some controversies in school nursing? Well, ethics. Ethics is going to be in every part of nursing you work in. It's always ethics, right? What about kids with DNR orders? What about if a girl asks where she can get an abortion? What about somebody coming to the health room asking for emergency contraception? I mean, and then future trends. Okay. You don't need to memorize this at all, but this is excellent. Online resources for school nurses. I use every single one of those. I did. Every single one of those. Excellent resources, page 556. And then there's your practice application. Okay, you have the answers to this. It says answers can be found in an Evolve site. You already have them. Now take advantage of these resources. There's lots. Okay, I have to end my time 6:55 so I can send it to the next group. Okay, cool. All right. Anybody have any questions on school nursing before we go back to 18? I loved school nursing. Oh my gosh, I loved it. Loved it. Did it for 20 years. But I can tell you right now, it is a lot different than it was 20 years ago. I mean, the issues that it's just unbelievable. And COVID on top of it has just brought lots of issues. Okay, let's go back to family, chapter 18. Okay, now we're back to family development and family nursing assessment. Okay, does anybody have any thoughts about why family nursing assessments are critical? I think families are going to have issues in your community. I think there's a gazillion issues that families might have. I think it's going to depend on everything, right? Where you live, how you live. I mean, we'll get into all that. Again, your chapter outline here is your PowerPoint. Your PowerPoint, I have to say that the right way. Your PowerPoint is your chapter outline with additional information in all these areas that have been pulled from the book. Okay, so if you don't look at your PowerPoint and you look at this, at least you know what we're covering. Your PowerPoint starts to give some information about each of these. Like I can tell you in your PowerPoint, when we talk about family function and family structure right here, there's a slide on each of them. And I think those slides are adequate, that you should be able to understand how we view a family function versus structure. I think the PowerPoints are adequate, but if the PowerPoint isn't adequate for you, where do you go to read on more detail, about more detail? The book. Okay. Objectives. After reading this chapter, you should be able to 1, 2, 3, 4, 5. Right? Explain the multiple ways public health nurses work with families and communities. Right? Number 3, let's go find the words. Describe family function and family structure. They're different. Okay, let's go to family structure. Let's hope this works. Okay, there's your family structure section right here. All right, so let's get going. So the next couple of chapters are going to be about family assessment, family risks, family. How do you assess a family in the community? Okay, so family nursing in the community. So what are we as nurses responsible for? We want to help families promote their health. We want to try and help them meet their needs. We want to help them cope with problems that may be existing within their family structure, right? And we want to try and develop interventions with them that might work for whatever they're facing. Maybe they have a kid that has a drug issue. Maybe they have a child that was born with significant medical needs. Okay. So we can look at the community in several ways. Started this talk last week. We can look at the family. We can look at the community as an individual. Let me take that back. In community nursing, we have different ways of looking at the community. It might be the individual themselves, might be the family, might be the whole community. It might be an aggregate of the community, the homeless, the drug addicted, the teen pregnant groups. There's lots of ways to look at the community health, but we're talking about family here. Okay, so we know that family demographics is the study of the structure of families. There's two things we need to know. 3 things we need to know. One is, what's the definition of a family? For purposes of this book, family is right here. Refer to 2 or more individuals who depend on one another for emotional, physical, and/or financial support. Okay, there's 2 things we need to know the difference between. What are family functions and what's a family structure? Let's start with functions. I'm on page 295. All right, historically, families have performed a variety of functions, right? 5 of these family functions are summarized here. So these are your most common historical functions. Every family has these functions within their family. They will look different with every family, right? Every family has an economic function. You can read what each of these are. Money management, housing decisions, insurance. Every family has a reproductive function. Okay. How many kids do they have? Were their kids born outside the marriage? Have they adopted? Whatever. Socialization function, right? Which is raising their kids to fit into society, take a place in the adult world. Affective function, families providing boundaries and structure so that they have a sense of belonging. And then healthcare function. All right, you can read about, you should know that there are 5, and just a quickie 1-sentence understanding of what each of those functions are. All right, families who perform well in all these functions are considered healthy families. Okay, over time, there's been a few more functions that have evolved. And so this book identifies 2 more. Relationship function. What does the contemporary family look like? Well, it looks a lot different than it did 50 years ago. Okay, and then the health function. Okay. Physical, mental health, or lack thereof. A lot different than 50 years ago. Okay, second is family structure. What's family structure? What's the structure of the family? I'm the mom in my family. Okay, what's my role? The structure is, it defines the roles and positions of the family members. Is there a mom? Is there a dad? Are there kids? Is there a dog? Is there grandparents? Is there aunts and uncles living with them? What's the makeup of the family? Okay. Box 18.2 is a great summary of structures, different structures. What might a married family look like? What might a single parent family look like? What might a multi-adult household look like? You didn't see this 50 years ago. I mean, it was probably happening, but it wasn't out in the forefront like it is now. So here's some examples of what a multi-adult household might look like. Okay. Next, family health. Here we talk about, this is hard for me to explain, but I'm going to try. So we talk about the difference between healthy families and not healthy families, which means dysfunctional or functional families that can be used the same way. Or there's another one, balanced families and non-balanced families. They all mean the same thing. Okay. Dysfunctional, unbalanced, and unhealthy are the same thing. So you might see it in different ways. Okay. So we know that the biopsychosocial, cultural, spiritual approach refers to individual members as well as their family as a whole. Right? We know that an individual's health affects the entire family. We know that the family's overall health affects all individuals in the family. Right? So thus, when we're doing our assessment of the family, we need to assess individual family members separately and the family as a whole. Okay. So here's what I just said. Health professionals have tended to classify families as 2 groups, healthy and non-healthy. Okay. Term healthy implies healthy mental health rather than that. We always think of dysfunctional in the terms of mental health, right? Like, didn't you all grow up? I did. In which we said, oh my gosh, have you seen like the Joneses down the street? They are all crazy, right? I mean, who hasn't done that? That's the stigma. That's how families were assessed, right? But it's so much more than that. Okay, so how do you do a comprehensive assessment to really assess the health of the family? Okay, well, yes, it is psychological, but it's also psychosocial, cultural, right? There may be a family that lives next door who's from a different culture who practices things the total opposite you do. That doesn't make them dysfunctional, right? So I want you to review box 18.3. Quickly, take a look at these 12, or start to take a look at them. What do they have in common? These are characteristics of a healthy family. What do they have in common?
family.
What do they have in common? For purposes of time, I'm going to answer your question. They are one unit. The family is seen as one unit. They do everything together. Everything's done as a unit. For purposes of this book, that is what a healthy family is. They do everything together. They share the same traditions and rituals. They have a shared sense of responsibility. They share leisure time together. They go to the same church. It's a unit. So think about a dysfunctional family with regards to this list. All right. So a dysfunctional family with regards to number one, what would that be? What would that look like? What would number one say? Some family members communicate well, right? Some family members affirm and support all of its members, right? Some of the family members have a sense of trust, some versus all. Okay, so that's the way we define healthy family in this chapter, is the family does everything together as one unit. So anything other than that, if you're asked about this, anything other than everybody doing everything together is considered unhealthy. Okay. Here's our levels of prevention. Okay, we're talking about family. So what do they want to do here? Primary. Let's review this. Let's review one of each of these. You guys can go back and review this. Just because I'm skipping through this quick doesn't mean you don't need to go back and review it. Okay, educate parents about healthy nutritional choices for young children and risks associated with obesity. Why is that primary?
They're trying to
Because
prevent.
it's preventable.
Right.
Prevention. Yeah.
Right. Secondary, screen teens for obesity with BMIs greater or equal to 30. Why is that secondary?
Because they're already obese.
Nope,
So it's
not quite
not.
yet. They're at risk for being
Screening.
obese.
Because
Alicia?
you are screened.
Alicia, did you hear me?
It's a
They're
diagnosis
at
purpose.
I did
risk.
not.
They're
It's a
at
diagnosis
risk for
purpose.
being obese. Go ahead. Why is that secondary? Somebody else answer.
It's a diagnosis purpose.
What?
It's for diagnosis purpose.
Yeah, you're screening. You're trying to identify. What do I always say about secondary? Early identification. You're trying to identify who's at risk by screening for BMI. Okay. And then let's say they've identified a group that is technically obese. Okay. Work with the schools to improve the quality of food offered in school lunches. Right. You're targeting a group that already has a health illness. That already has an illness. Okay. Okay, here's 4 approaches. This is what I was trying to explain a little while ago. We have 4 approaches to family nursing. Okay, the first is family as a context or structure. Okay, what do we need to know about this? This is where we look at the individual first and the family second. So a nurse may ask, how has your diagnosis of type 1 diabetes affected your family? So we're focusing on the individual. Next, family as a client. Okay, so we're looking at the family first now and individual second, right? So the nurse might say, tell me about what's going on with the health and how each member, tell me what's going on with all the family members and how they're feeling now that your mom's been diagnosed with liver cancer. So it's focused on the family. How is the family functioning as a whole? And then you have your family system, okay, in which the focus on the family as a client, the family is viewed as an interacting system in which the whole is more the sum of its parts. What that simply means as, what might the nurse ask? What has changed between you and your spouse since your child's head injury? How do you feel about the fact that your son's long-term rehab will affect the ways in which members of your family are functioning, getting along with each other? Right? And then the last is looking at family as a component of society. How does your family interact with society, interact with your community? Right? Are they out there socializing, using resources, or are they just, they're not reaching out for anything? Right? The family if the family as a whole interacts with other institutions to receive, exchange, or give services, that's what you want them to do. Okay. We're going to talk about one theory that I want you guys to know about. It's in your study guide. It's the Friedman model. Okay, but we'll get to it in a minute. It's not till further along. Okay, so again, I'm skipping through here for now. All right, so now we're going to work with families for healthy outcomes. What do we need to do? Here's where your nursing process comes in. Okay. This is when you're meeting with the family. This is the process you go through. There's several steps here. Okay. But I'm skipping through these because there's a nice little box right here. Well, take that back. There is a box, but all these boxes, look where it is. So this, how to make an appointment with the family, how to, is right below making an appointment with the family. So that's like a little cheat sheet, how to make an appointment. Okay. How to plan for assessment process, how to plan for personal safety. I want to pull this part out. This is an important part we need to know. One of the key concerns in home health, home visits is planning for personal safety. Okay. It's critical to plan for your own safety when you're making a visit. I know I just jumped down here. There were a whole bunch of steps before that, but I'm going to show you down. Where is it? Thought there was a box that went through all these. Maybe there isn't. So you'll need to go through this. Okay, these are your steps. Pre-encounter data collection. 1, determining where to meet the family. 2, making an appointment with the family. 3, here's some tips. 4, planning for personal safety. Okay, we're stopping there for a minute. Okay, what do you need to do to plan for your safety? You need to read through this. Here's your home visiting safety tips. Okay. Leave the schedule at your office. Plan the visit during safe times. Why do you need to sit between the client and the exit? Why?
An easy exit, just in case things turn south.
Or something happens, you got to get out. Okay. So this section right here on 302 is important to know. Okay. Next step, interviewing the family. Here's a sample, 18.6, how to do interview questions. Designated family interventions. Again, we're going through the nursing process. Okay. Here's your case study. Okay, for family assessment. Have a look at it. I've already provided you the answers. Okay. And then lastly, evaluation. So if you go through those 7 or 8 steps, that's applying your nursing process ADPI to a family assessment. And in another chapter, we're going to apply our ADPI to how to do a community assessment. Okay, so you have to be able to take your ADPI and shift into all these different scenarios in the community. Make sense? Okay. There's another case study. Okay, you've got the answers to that as well. This chapter had 2. How do you do a family nursing assessment? Right, a family nursing assessment is the cornerstone of all family nursing interventions. Right, by using a systemic process, which is your ADPI, family problems are identified, family strengths are emphasized, and building block as the building blocks for interventions. Right, building interventions with family identified problems and strengths allows for equal family and provider commitment. Right? We need the family to buy in. We need them to be part of the assessment. What do they think their problems are? They should be part of the planning process. They should be part of the intervention process. They should be part of the evaluation process. And here's your QSIN box. Okay, so in this chapter, the competency is client-centered care. So then the rest of this box is focused on what are important aspects of the competency of client-centered care. with regards to knowledge, skills, and attitudes. And here's your question, client-centered care. And then the one model I want you to know about is the Friedman assessment model. This is the most commonly used assessment model. Okay, this model draws heavily on the difference between functions and structure. Remember functions from way up top, the 5 different functions of a family: economic, reproductive, social, health, right? Okay, so that's what it focuses on. But just have a look at this right here. Okay, and then they get some guidelines of how you would interview. What do you want to find out? Well, look at your nursing process. We want to identify data. We want to get a developmental family stage in history, right? That's your data collection. Environmental data, collect that. What's the communication structure, power structures, role structures? What's the values? Right? So this is the model, most common model that we use, Friedman family assessment. Okay. And then we get to our Healthy People 2020. I'm going to have you go through, and there's 1, 2, 3, 4, 5, 6, and read through these. But look, their objectives are specific to families and family nursing. Okay, let's just go through the top one. What are one of their objectives? Increase the proportion of parents who use positive parenting to communicate with their healthcare providers about positive parenting. Okay. I mean, that's beautiful. That's great. Okay. Increase the proportion of adolescents who talk to a parent or guardian about reproductive health topics before they're 18. We want that. That's great. And I showed you, and if you've listened to it, I showed you in the lecture Saturday morning, right off the bat, how to go into Healthy People 2030 and look at the report card of how we've been doing with Healthy People 2020. Okay. Okay. So that's our family assessment. This is all, these are all about family. Next, we're going to talk about family health risks. Anybody have any questions about family development and nursing assessment? Again, you know the drill. PowerPoint, chapter outline. This is kind of a big one. Actually, the next one is the biggest one, the next chapter, which is health risks across the lifespan. So let's get there because it's already 9:18. Here's your objectives. You got to be able to analyze, determine, understand, explain, discuss. Okay, there's your key terms. Okay. Early approaches to family health risks. All right. So early approaches, real quick, health of the family. So historically, right, we have looked at the health of the family, health and illness of the family, focused on 3 major areas, right? The effect of illness on the families, the role of the family and the cause of the disease, and the role of the family in its use of services. Okay. This is important right here. The energized family is characterized as one that promotes freedom and change, is actively engaged with a variety of other groups and organizations. So we're talking about healthy families, has flexible role relationships, has equal power structure. Each member has autonomy. Okay. So there's let me go back. Let me read this, start this again. Exhibits a high degree of autonomy in family members, right? Proposed a family member health and illness cycle compromises 6 phases. Okay, so here's 6 quick phases that we want to look at. Okay, family health promotion and risk reduction. We're going to go through all these. Continuing through the family's vulnerability. What's their risk to illness? What's their response to illness? And what's their interaction with the healthcare system, right? And then finally, how do they adapt? That's all. There's all sections of all those below. Okay. And we have to understand when we start this chapter, we have to understand the concept of risk. What's risk? We take risks every day, all day, right? For purposes of this chapter, the concept of risk, it refers to predisposing or increasing the likelihood of ill health. All right. What is your risk of developing cancer? What is your risk of developing asthma? Your kid developing asthma? I don't know. Do you have parents that smoke in the house? What's the risk to the kid? Right? Your family has a history of cancer. Well, you're going to have probably an increased risk of cancer. Okay, so that's how we're talking about risk in this chapter. Here's your Healthy People 2020 box, just has 2 objectives. Okay, and it's related to family health. Eliminate very low food security among U.S. kids or among children in U.S. households. Increase the proportion of smoke-free homes. Okay. Right, so family health is defined in terms of system stability and characterized by 5 sets of factors. Okay, this is the makeup. This is how you assess family health with every family. It's going to look different, but there's 5 interacting factors. They're right here. Physiological, psychological, sociocultural, developmental, and spiritual. Okay, it's on page 312. The family is seen as a whole system with the 5 interacting factors. So these are all going to be present in every family, but they're all going to look different in every family. Make sense? You guys with me? And here
Yes.
they give a little example of the Harris family right here. Okay. You can read about 3 lines of what's going on in the Harris family. Okay. And then they talk about how these 5 variables should be assessed within the Harris family. Okay. So have a look at that. And we are already talking about health risks, right? We know about health risks. Think about COVID. You know, who is more susceptible during COVID to getting sicker? The elderly, right? So the elderly had a higher health risk of COVID versus school kids. Who has a higher risk of falls? Elderly. Who has a higher risk of not wearing seatbelts? The younger kids, right? Who has a higher risk of SIDS? Infants, right? So how do we do health risk appraisals, right? We're assessing the presence for risk factors, right? How do we try and do some health risk reduction? Well, if we know that if kids have obese parents, well, they may be susceptible to obesity. So how can we work with do health risk reductions with those kids? Right? What will decrease their probability of ending up obese? And then what does a family in crisis look like? All right, that's the definition. When a family crisis is, the definition is with it when a family's not able to cope with an event and becomes disorganized and dysfunctional, right? When the demands of the situation exceed the resources. You'll be involved with that. How do you deal with a family crisis? What do you do? How do you help them with family coping strategies? Okay, so here's some major family health risks and nursing interventions. Okay, there's 3 main areas where typically the family's health come from. Okay, or the risks come from in a family. Biological, which is hereditary, I guess you could, for hereditary, biological. Age-related risks, or biological and age-related risks go, that's 1. Environmental risks and behavioral risks. So let's tackle this. Okay, because a few things you need to know. Here's some definitions that we're going to talk about here in the next few minutes. What are the determinants of health? Okay, what's your biological makeup? Okay, does your family have a history of alcoholism? They have an history of cancer, cardiac. Okay. What about behaviors? Right? Are there are bad or good behaviors learned from other family members? Right? Social environment. What's the culture? What's the language? What's the personal beliefs? It's physical environment. Where do they live? Do they live in an old home that may be have lead-based paint? Is their home clean and safe? Do they live near, in train tracks where it can be unsafe? I don't know. So there's two things I need you to understand. We're going to talk about biological and environmental. This is where the terms genogram and ecomap come in. Okay. When we do a biological risk assessment, that's a genogram. Okay. I'm going to use my own personal example. All right. Because I get frustrated when students get these questions wrong on the test because that means I didn't explain it well. So I'm going to use my own example. Okay. A couple of years ago, I was diagnosed with breast cancer. I have no history of breast cancer in my family. Okay. So you couldn't really say I was predisposed to it because we didn't have any history. So that required a genogram. Anybody know what a genogram is yet? Anybody figured out what a genogram is? Anybody looked ahead? Okay, so a genogram is the history. So one of them, we're talking biological health risks. So this is hereditary. One of the most effective techniques for assessing the patterns of health and illness in families is a genogram. And it tells you what it is. It's a drawing that shows the family unit of immediate interest that includes several generations. Okay, basic information about the family relationships in a family and patterns of health and illness. So I had to have this done. Okay, so my genogram, we go back 3 generations. And what we need to figure out is who's died of cancer and what kind of cancer, because we couldn't figure out where my breast cancer came from. So we went back and did this historic 3-generation genogram. And that's to try and identify where this is coming from. That makes sense? So that's what a genogram is. It's the history. Along with a genogram goes genetic testing. Okay. Not everybody has to have genetic testing. This is important. Okay. The reason why I did was because it was an unknown. This popped up as an unknown. If I had had a family history of breast cancer, I wouldn't need genetic testing because we already know I'm predisposed. Make sense? So, for example, if you come from a long family of cardiac issues, you're already predisposed to that. Okay. You probably already know what your genogram is, and you don't need genetic testing. So that's for the unknown. Okay. And here, genetic testing is very personal. I could have opted not to have it. Okay. But I have one daughter, and I wanted to know if I was carrying that gene that would carry breast cancer. I wanted to know, but we have to be very empathetic that they're very personal decisions. Some people don't want to know. Right? We have to be supportive of whatever they want to do. We have to respect individual and family members' decision-making. Okay. Now here, environmental risk, separate. This is an ecomap. Okay, so we just went through biological risk, environmental. It refers to social. Environmental refers to social risks. Okay, so we know, important statement right here, very important, 319. The poor are at greater risk for health problems. Economic risk, which is related to social risk, is determined by the relationship of financial resources of a family and the demands on those resources. So what I want to say about this is that financial stability drives everything, or financial instability. Okay? Financial stability drives everything. Housing, clothing, food, education, health, insurance, care, right? And the amount of money that a family has is related to situational, cultural, social factors. Maybe the family lives above the poverty level, but they've had an illness that has devastated the family. Okay, these are social economic risks. But one thing to remember here is, if you're asked, what is the greatest risk or what is the greatest impact to family health? Financial stability. It impacts everything. Okay, so how do we do an environmental risk assessment? This is our called our eco map. Okay, and it's social risk. So we want to know, how is the family connected with the community? Assessment of the environment is less, it's social risks. Information on relationships the family has with others, such as relatives, neighbors, connections with the community, church, school, work, clubs, right? Are they engaged or are they not engaged? Okay, so an eco map represents the family's interactions with other groups and organizations. Okay, so right here, here's your eco map. Let's assume this is me. Okay, I'm in the middle. My family's in the middle. We have relatives, we have sports teams, we have church, we have banks, we have potlucks, we have da 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 da. Okay, this is a really busy family. Okay, what happened with COVID? We just had a single family in here, right? All that went away, right? Now we're starting to build back out again. Okay, so mine went from all this to a single, and now we're starting to get those relationships back in. It's important. That's part of your family assessment. If this is just a single circle with a family and they have nothing going on out here, that's potentially a problem. Why don't they have any social interaction? Why don't they have any relationships in the community? Okay. And here's what I said. Economic risk is a key predictor of health. Okay. So let's see. And then they talk about behavioral risks. So we went through biological and environmental. And then there's behavioral risks. You can read through this. Nothing you need to memorize in this section, but please read through it. Okay. And again, here I did highlight part of it where it says the literature consistently identifies the following family factors that decrease the risk of substance abuse. So with regards to behavior, they're saying that a healthy family that has family closeness, doing activities together, positive behavior model by the family, that hopefully reduces the behavior of, our risk for substance abuse. Okay. And then home visits. What you need to know about here is home visits. We feel in community health that home visits are the most important way to gather information. If you're going over there to change a wound, change a dressing of a wound, what other things can you look for over there at the place? What can you look for? Safety, food, environmental risks, social risks, relationships, communication, right? Okay, here's a couple of things you need to know. I'm going to get moving because I do want to cover chapter 20. I want you to know box 19.2, right? If you're going to be doing home visits, what are the phases? 5 phases. Okay, think about ADPI. It just looks differently. This is ADPI just looking different. This is ADPI applied to a home visit. Know your different phases. There are 5 of them. You don't need to memorize everything in the activity section, but just get the gist for what are we doing in the pre-visit? Okay. And then it goes through each one, initiation, pre-visit. Okay. I want you to read through this section, page 324, right? Visits can be voluntary or non-voluntary. Voluntary visits are the fun ones. Those are the ones where the people usually reach out and say, could somebody, a new parent, can somebody come over and see if I'm doing breastfeeding right? See if I'm doing this right. But there may be involuntary visits, which may be court ordered, law enforcement ordered. You might be doing a visit with the local police officer. I don't know, child abuse and neglect, who knows? But also another example is TB. A lot of cultures, a lot of people don't understand that if somebody's diagnosed with TB in the community, in the household, the nurse, public health states, the nurse must make a visit to make sure they're taking their medication. Well, it may be a considered non-required, but they may not understand. They may not understand what TB is, why you have to visit, and what happens when you do an unannounced or unplanned visit. Probably not pretty, people probably aren't pretty happy about it. So you have to be really, really, communicate, try and explain to them why you're there. This isn't anything negative. I'm talking about the TB patient. You may have to explain to them that, this is a requirement. It's nothing punitive or you haven't done anything wrong. We're just following up. It's a public health requirement. And then your in-home phase. Okay, here's some reasons for a home visit. 19.2, many reasons for home visits. Okay, and then here's your QSIN, right? This competency is focusing on safety. So I've had 4 different competencies, or 3 so far, right? So there's your safety. Have a look at that. And then we're still going through the phases, which were presented to you above. This is just the more detailed version. And then contract. What's a contract? Contract has to be mutual, agreeable between 2 or more parties, right? Why do we contract with families? Because we want them involved, right? 19.3 on page 327 gives you your 3 phases of contracting. Again, think ADPI. This is your ADPI translated into contracting. So have an idea of what your 3 phases are. Okay. And then your levels of prevention. Okay, related to families. Okay, primary, complete a family genogram and assess the health risks with the family to contract for family health activities and prevent diseases. So maybe you're doing a genogram ahead of time, seeing what they might be susceptible to or predisposed to, right? And then coming up with a plan for prevention. Secondary, use behavioral risk survey to identify problems such as obesity in the family. Why is that secondary? Screening, but we're trying to identify early identification. And then tertiary, we're developing a contract with the family to change nutritional patterns, right? Because we've identified that we have obese family members. So the illness is already there. We're developing a contract with families to change nutritional patterns. Okay. So there's your practice application that you have the answers to there. Okay. And the last one, this is a big one. You need to pay attention to this chapter because this is what this whole class is about. The whole term, health risks across the lifespan. This is why I say you have to bring so many tools and skills into community health. You may be caring for an infant all the way up to a frail elderly client. Okay, what are the risks all across? They're different from an infant to a toddler, to an adolescent, to a child, to a teenager, adult. They're different with men, women, elderly. Okay, so look at how long this outline is. This outline is a pretty long outline. Okay, that's your PowerPoint. Okay, take a look at it. Target areas for prevention with children, smoking, nutrition, immunizations, major health issues and chronic disease management, health disparities among special groups, adults of color, incarcerated, LGBT, adults with physical, mental disabilities, frail, elderly. These are all clients you're going to come in contact with across the lifespan. Okay. Here's your objectives. You should be able to articulate, discuss, describe, explain. Okay. Children's health and major public health issues. Right. We know that the health and well-being of kids has an impact on the future of the country, the world for that matter. Right? Making sure kids are healthy, have immunizations, have regular dental, primary care visits, health education. right? Making sure kids have insurance. It's all part of ensuring health across the whole lifespan, right? Because physical, cognitive, and emotional changes occur so rapidly during early childhood development, it's even more of a reason that they need to be monitored, right? And then we start going through issues, okay? Obesity. Okay, we're still in obesity. Box 20.1 gives you family recommendations for family recommendations for obesity prevention. Okay, so this is primary, right? Box 20.1 has lots of different, read this, know this. Okay, do we want to cook a meal? Do we want to bake or do we want to fry? Do we want to do low fat food or high fat food? Do we want to do 100% fruit juices without sugar or limit that? So you may get asked, you know, what are select all that apply? I don't know. What are some things you might do for when you're talking with a family about obesity prevention? I mean, you know what's good. You know what's good. You know what's bad. You don't have to memorize all this. If it doesn't sound healthy, it probably isn't. Right? Next section is injuries and accidents. Right? Injuries and accidents are the most common causes of preventable diseases, disabilities, and death among kids. Unintentional injuries are injuries sustained by accident, you know, such as falls, fires, drowning. Somebody mute, hang on. Falls, fires, drowning, suffocation, poisoning, sports injuries, motor vehicle injuries. Okay. Here's your QSIM. Okay, again, we're on another competency, client-centered care. Have a look at that. So then you go through your different sections. Okay, so I need for you, you're going to have to go through these on your own. But it goes through all the different developmental stages. What are infants? What are infants predisposed to? What are their risks? What are toddlers? How about school age children? It gives you examples. School age, they're talking about bike accidents. What do you want to do? Well, we want to make sure they wear helmets. Toddlers and preschoolers falling and being stuck between something, right? Infants, we think of SIDS. Okay. Then adolescents, we start talking about motor vehicle, you know, seatbelt. How do you prevent injuries? Okay, here's an excellent box 20.2, injury prevention topics. Look at all the things we can try and discuss in a primary way. Prevention, car restraints, seat belts, preventing falls, safety driving practices, bicycle safety, sports safety. Okay, and believe it or not, what if you're the community nurse and you're the city manager comes to you and said, hey, we just got a big grant for a big playground outside the rec center. And we're going to get to build a big program or playground. What should we do? What's safe and what's not safe? So you actually have to know about playground safety. What's safe? What would you do? Develop in your input in developing a playground. What would be safe and what would not be safe? Okay, should know that. And then gun violence, okay, another huge risk. Okay, you can read through this, it's page 339. What I'm going to tell you is, I do need you to read through this section, but you know, let's say you go do a home visit. What's the first question you ask?
Are there any weapons in the home?
Are there any weapons in the home? No? Great. Okay. Yes, there are. Claudia, then what? There are weapons in the home. What are you going to ask?
How are they stored?
Show me where they're stored. You visually want to check where they're stored. Number one, they could be lying to you. You need to make sure they are secured and locked and stored properly. Now, some of you may say, no, nobody's walking around my house looking at to see where they're stored. Yes, that for purposes of this chapter and learning about gun safety, that is what we are asking the community nurse to do. First question, do you have any weapons? Yes, we do. Can you please show me where they're located and ensure that they are properly locked and secured and stored? Okay. You know about child abuse and neglect, right? We all know we're mandated reporters, right? I don't have to explain what a mandated reporter is, right? And then again, across the lifespan, we're in kids now, alterations in behavior and mental health problems. Look at all of these things we see with kids: eating disorders, attention problems, ADHD, substance abuse, sleep, anxiety, autism. These are health issues across the lifespan. Okay, how do we deal with acute illnesses? Okay, do you guys know how to deal with lice? Do you know how to deal with conjunctivitis? This section in your study guide from this chapter is excellent. I mean, you may be doing things as basic as hand washing. Okay. And then we start, well, this section on chronic conditions is about kids. You may be working with kids with chronic health conditions: Down syndrome, spina bifida, CP, asthma, ADHD, diabetes, and on, right? We need to make sure the families can handle this. You know, what if you've got a very impacted kid and you're doing a family assessment and the kid keeps missing his PT appointments or OT appointments? I don't know, are they not getting scheduled, or do they not have the transportation to get there? They not have the money for gas to put in their car? These are things you have to watch, right? A severely impacted kid requires coordination of care. Can the parents do it, or do they need help doing it? The child has to get to these appointments. That's part of your assessment. Same with asthma. Let's say you have asthma, kids with asthma. Okay, what if they live in a smoking home? What are you going to do? Obviously, the end goal is non-smoking home. What are you going to do with the family? How are you going to help them? It's this section right here, 341. How are you going to help them? Interventions to discourage smoking on the parent. You know, can you provide them educational programs dealing with the negative effects of smoking on children, especially with asthma? Maybe give them some tools to try and stop smoking, ways to create a smoke-free environment. I don't know. What if a mother, you're doing your assessment and the mother says, don't worry about it, I went from 3 packs to 2. Is that okay? What if they say, I'm vaping? Don't worry, I'm vaping now. Is that okay? No. What if they say, I'm now smoking outside? Okay, that's moving in the right direction, but your job is to help them create a smoke-free environment. I mean, think about the multitude of issues you may be dealing with working in the community. There's so many. Immunizations. Did we already talk about this, or was that in my earlier class? About parents that don't want to get immunizations. Have we talked about this today? What are you going to do? You know, fine, they're not going to get them. Well, now what? Well, now we need to educate them on what's going to happen if there's an outbreak of something around them that they're not immunized. You know, how do we educate them on what are the safest things to do? Oh, here's your, okay. We talked about this at the very beginning of class. Here's your 5 federal pieces of legislation. All right. So 5 examples of federal legislation that have influenced the health of adults in their lives. And here they are. You can read through them, put these on a card. Patient Self-Determination Act. This is important because what this says is that we want the patient involved. If they are competent, they should be involved in every aspect of care. Okay. Then we have the Older Americans Act. Right here. That's Patient Self-Determination 1, Older Americans 2. ADA, we all know what the Americans with Disabilities Act is, right? Protecting against discrimination. And again, here's the other. Let's just stick with this. They mentioned Patient Self-Determination Act up here, but let's look at the lower part. So here's the first one, older Americans, ADA. Here's a better description of the Patient Self-Determination Act, right? That some place that's receiving Medicare and Medicaid funds, right? You have to give the client legal and written options. You have to give them their legal options in writing if they become incapacitated, right? But if they're not incapacitated, they need to participate. Okay, and that's when we talk about advanced directives, living will, powers of attorney. The fourth one is Family Medical Leave Act. I should be able to take time, you should be able to take time off to go care for your sick kid, your elderly parent. And then the last one is this Personal Responsibility and Work Opportunity Reconciliation Act, right? It's commonly known as welfare reform. Okay, so those are the 5 federal legislations that have influenced the health of adults. Okay. What are some ethical and legal issues for older adults? Well, there's lots. This is where we start talking about, I hate to use the word, but we start talking about elder abuse. Right? It's big, 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 big. Okay, we need to know about elder abuse. This page 344 starts that discussion. Ethical and legal issues. Okay. One often overlooks the concern of elders and abuse. Okay. What is elder abuse? What might it look like? Infliction of physical pain, mental abuse, fear of telling somebody, whatever, theft or mismanagement of money, right? Unreasonable confinement, deprivation of services. Okay. And then we also talk about across the lifespan. This is chronic illness at the adult level. Okay. I need you to read this right here. Okay. It's 344. What do we try and do with adults, elderly with chronic illnesses? We try and help them achieve the highest quality of life, possible quality of life, right? Self-care, managing their disease, healing, preventing complications, preventing deterioration, trying to help them achieve the highest possible quality of life. What can't we do? What can't we do with a chronic illness? We can't cure it. We can't prevent them from dying. But we can do all these other things in here. And so that's why I waited for number 7 at the end. We want to help them die with comfort, peace, and dignity. Okay. You can review this. Your Healthy People box is on 345. And it's related to chronic disease of adults. Okay. And then here's your levels of prevention. You can review this as well. Here it's designated to talk about the example of cardiovascular disease in women. Okay, so keeping that topic in mind, read through these interventions and make sure they make sense. If they don't, let me know. Okay. It goes through, let's see, where is it? It goes through women's health concerns. There's a few of them: eating disorders, reproductive health, gestational diabetes, which is obviously pregnancy, menopause, breast cancer, osteoporosis. And that goes through some men's health concerns. So just be aware of what typically are the major concerns identified between men and women. Okay. Here's cancers unique to men: prostate cancer, testicular cancer, erectile dysfunction. And then read through, or really what I would like for you to know is what special groups might actually suffer from some health disparities. Okay, and what do we mean by health disparities? They may not have the same access to care and resources, right? And here's 4 groups: adults of color, incarcerated adults, LGBT, and adults with physical, mental disabilities, and the frail elderly. And again, we introduce elder abuse. Okay, so those are your 5 potential populations that may experience health disparities. Okay. And then the last section I want you to review, because it's 9:55 and I want to get our attestations done, is I use the example of my mother. This is what community care is saying. Let's say my mother is coming to live with me, which that's not happening, but let's just say she is. Okay. Let's say she's fine. She's fine. She just, my dad passed away. She's lonely. She's going to come live with me. Let's say she's fine. She's with it. And after a week, 2 weeks, I determined that she's just really lonely. Okay. She needs to get some social interaction, but she's fine. Maybe a senior center would be okay with her. So read through these different options. Okay. Senior center. She just needs some socialization. What would adult day health be? What would home health and hospice be? What if she started falling down the stairs? What if she started cooking and starting fires? This is more for the elderly. There's different levels. If you get a question that says, so-and-so was starting fires accidentally, or didn't know how many confusing her medications, taking Friday with, Monday's medications on Friday. You need to take a look at these 4 or 5 different options, from senior center to adult day health, home health, assisted living, long-term. Where would you place these people? What are the resources you have? Okay. There's your practice application if you want to go through it. Okay, so there you go. I don't like to talk for 2 hours, but I just did. And I know you guys are exhausted. Look at even the baby sleeping. I put Rachel's baby to sleep. So anyway, let's pull up our week 2 attestation. And I can tell you right now what the question is. What's primary, secondary, and tertiary, and give an example of each. So let's get that done. We have 3 minutes to spare. Just check in. Helpful information. I know it's a lot and I know it's late, but did you get the gist of what we were talking about today? Was it helpful?
Yes.
Do you all plan on coming to a review session this upcoming weekend?
Yes.
Good. All right. What's primary, secondary, and tertiary? What's primary? Everybody start typing. What's primary? What's P? Primary goes with?
Preventative.
Thank you. Prevention. Secondary goes with?
Screening,
Tertiary goes with?
treatment,
Example of primary.
Vaccination.
vaccines,
Vaccines. Awesome. What's an example of secondary?
Mammograms.
Boom. Done. Perfect.
pap
And what's
smear,
Pap smear? Yeah, whatever. Screening. What's an example of tertiary?
Yak rehab.
treatment, diabetes management,
Rehab, diabetes management. Something already exists. Diagnosis, illness, whether it's permanent, temporary, chronic. And boom, it is 1 minute before. At least I didn't keep you after, which I would hopefully never do with these guys. You guys have just got to be absolutely spent. So I'm going to stop my recording. Okay.